Hello, everyone, and welcome to this live and interactive session, during which we'll be discussing how Novo Biomedical's unified approach can help you, our valued partners, advance quality, efficiency, and confidence in today's clinical labs. Kicking off today's session, I am Martin Ekiti, Medical Officer of Novo Biomedical based here in the States, also serving as a Medical Director for North America. Following my quick introduction, my colleagues Brian, Jess, and Jess will be speaking on different aspects of our proposed partnership. Brian O'Connor is our Global Training Manager, Jessica McDermott is our Clinical Training Manager, and Jessica Nurigian is one of our Clinical Product Managers. Because the title of today's session is Latte and Learn, I feel I must kick off the little bit of housekeeping by mentioning that we would love to send out the latte vouchers to you tomorrow by email. But to enable us to do that, please scan the QR code in this slide or click the link in the chat to receive your voucher. Also, we would love to hear from you. So please utilize the chat feature to submit any questions you might have. We will do our very best to get to them during the session, but if we have some time at the end of all the presentations, we'll address any unanswered questions from the chat or take some live ones as well. Over the next couple of minutes, I'll be summarizing who we are as a company, Novo Biomedical, why we do what we do, and how we go about doing this. Novo Biomedical is a leading developer of scientific and diagnostic instruments and consumables, and also a curator of first-in-class services and customer support. As a global leader in osmolality testing and the inventor of many firsts with regards to whole blood biosensor development, we are one of the world's fastest growing in vitro diagnostics companies. With a direct and indirect presence on every continent of our world, Novo Biomedical supports customers in over 120 countries. Headquartered in Waltham, Massachusetts, we operate a highly integrated and standardized global force to ensure that all our customers worldwide get the same standard of products and services throughout our partnership. Many of you may have had interactions with devices from Novo Biomedical, Advanced Instruments, Solventum, or Artel in the past, but today all these great brands are unified under one banner, Novo Biomedical, which leverages the combined 120 years of expertise across biosensors, osmolality, cell line development, and liquid handling, reducing your vendor complexity. This 2025 M&A created a single, stronger partner committed to accelerating innovation and support across labs and healthcare systems to improve patient care. Our vision as a company is to improve the health of every patient through innovation and excellence, and our mission is to innovate in a way that delivers optimized processes and increased efficiency, ensuring confidence in results and improved patient outcomes. Our clinical products are thoughtfully developed and built on 4 guiding principles deeply rooted in value-based care. Firstly, we seek to improve population health by enabling early detection and quick interventions, expanding access to reliable testing. Secondly, we reduce the cost of care by shortening length of stay and preventing costly complications, all the while enhancing patient experience by reducing blood volume requirements and enabling timely clinical decisions. And finally, we ensure that we keep your satisfaction or providers optimal by availing you, our partners, with easy-to-use systems with minimal training requirements. With an approach that's driven by voice of the customer feedback, we raise provider satisfaction by deploying our vast array of equipment within streamlined workflows. Our portfolio, which my colleagues will develop in the next few minutes, can be found across the continuum of care, in the core lab, at the point of care, and even outside of the hospital walls. We have just spent some time talking about how Novo Biomedical can partner with you to improve patient outcomes. Now I'll pass it over to Brian, who will walk you through this partnership on a more personal level, taking the conversation directly to the hospital floor in a way that should sound very familiar to you. Over to you, Brian.
Thank you, Dr. Ekiti. Before we dive in, I want to start by reframing the conversation. When we talk about point of care, blood gases, osmolality, CSF cell count, cultures, volume verification, it sounds like a list of disconnected tests and instruments. But this presentation isn't about instruments. It's about how the lab quietly drives healthcare, especially when there's uncertainty. It's often said that nearly 70% of clinical decisions are influenced by diagnostic data, which puts the lab at the very center of patient care, whether it's visible or not. At Nova, we don't think in terms of selling individual devices. We think about providing data that enables insight to help clinicians see problems earlier, make safer decisions, and reduce downstream harm. Because the lab delivers answers the clinicians can trust. And when things are routine, that impact can be easy to overlook. But when patient conditions aren't clear, that's when the lab matters most. Next slide, please. Now, what I'd like to do is use a hypothetical story to put this all into clinical context. Next slide, please. An adult patient in their mid-50s arrives in your emergency department in the early morning hours, unresponsive, warm to the touch, and with no known medical history. Let's call this patient Alex Morgan. In that moment, the care team isn't thinking about diagnoses yet. They're thinking about survival. And two questions immediately come to mind. Why is Alex unresponsive? And how fast can we safely find out? Before imaging, before consults, before definitive treatment, there are blood samples and the lab. This is where the lab quietly takes the lead, delivering answers in minutes that determine whether the next decisions help or potentially put the patient at risk. Over the next few slides, we'll walk through Alex's journey from first sample to final diagnosis from the lab's perspective, showing how each result removes uncertainty and guides what happens next. This is where the patient journey truly begins. Next slide, please. And this is where the story becomes real. Alex arrived with no history, no context, and no margin for error. In that moment, clinicians don't have answers, but they do have questions. First, is this something we can diagnose and treat right now? Second, what system is failing? Is it metabolic? Is it respiratory? Is it cardiac? Renal? Is there an infection? Is there a toxin in the system? And third, what can the lab answer quickly compared to hours from now? At this point, their care team has very little to go on. So this is ground zero. From here on, every decision that follows, every treatment, every escalation, every risk depends on how quickly and reliably the lab can turn uncertainty into clarity. And the very first step in answering that question can change the outcome in minutes. Is there immediate diagnosis with a reversible cause? Next slide. With Alex unresponsive, clinicians immediately consider causes that are both common and dangerous: glucose extremes, respiratory failure, shock, and cardioelectrolyte instability. This is where point of care testing matters. Glucose, blood gases, lactate, electrolytes, ionized magnesium deliver actionable answers in minutes, not hours, identifying whether treatment needs to start immediately. But the lab's role here isn't just speed. It's providing results clinicians can safely act upon, especially when decisions involve high-risk therapies like insulin, fluids, or airway management. And here's an uncomfortable truth. Standards allow for up to 5% of glucose results to be erroneous. At a scale of billions of tests per year, that is not a rounding error. That is real clinical risk. The FDA receives tens of thousands of adverse event reports related to glucose meters, including serious injuries and deaths. And that's why the lab's role here is critical, and speed alone isn't enough. In the first moments, the lab transforms uncertainty into direction. helping the care team treat what's reversible, stabilize the patient, and avoid early missteps that can cause harm. Next slide. In step 1, we saw how quickly the lab can surface an immediate reversible threat. But speed only matters if that result is right. And this slide explains why that answer has to be right. Glucose is a perfect example. It's fast, it's trusted, and when it's wrong, it can be dangerous because it directly drives insulin, which is one of the highest risk medicines in hospital use. The literature is clear. Some point-of-care glucose systems are not suitable for critically ill patients, where anemia, oxygen shifts, renal failure, and medications are the rule and not the exception. That's why the lab is essential here, not just for compliance, but for validating performance, understanding limitations, and protecting patients from mismanagement. So the takeaway is simple. Accuracy isn't a technical detail in the lab, it's patient safety. In this pattern, fast answers that must also be trustworthy and safe is one we'll see repeatedly as Alex's journey continues. Slide. So if accuracy is patient safety at the individual level, let's zoom out for just a second because the ripple effects go far beyond a single result. Everything we're going to talk about and walk through in this case study directly ties to the quadruple aim concept. Yes, improving patient outcomes matters. Yes, reducing cost and length of stay matters. But in recent years, provider satisfaction and burnout matter just as much, especially in the ED and the lab where staffing continues to be a challenge. This is where the lab quietly makes a difference. When results are fast, reliable, actionable, clinicians make better decisions sooner with less second guessing and less reworks. When results are delayed or inconsistent or difficult to trust, pressure builds on clinicians, on the lab, and ultimately on the patients. What you'll see as we continue this story is that precision and speed don't just improve care. They reduce noise, friction, and burnout. So this isn't just a patient journey, it's a story about how the lab supports better outcomes, safer decisions, a more sustainable healthcare system, one decision at a time. Once those immediate life-threatening issues are addressed, Alex may look more stable, and that's often when care can quietly become dangerous if we miss what comes next, because the next step is imaging, and suddenly one question matters more than anything. Is it safe to move forward? And that answer lives in the lab. Creatinine and eGFR don't slow care, they protect it. They tell us whether contrast is safe, how medications should be dosed, and how aggressive fluids can be without causing harm. At the same time, another risk is often hiding in plain sight: cardioelectrolyte instability. This is where magnesium, ionized particularly, becomes critical. Low magnesium fuels arrhythmias and makes potassium impossible to correct. Renal failure flips the risk. Magnesium accumulates, slowing the heart and dropping blood pressure. At the bedside, this often feels sudden and confusing, whereas in the lab, it's visible and preventable. Once again, the lab isn't reporting numbers in isolation. By seeing renal function and magnesium together, it's making sure the next decision is safe before harm occurs. So once the lab has helped determine that imaging and electrolyte correction are safe, the clinicians face the next critical question. How do we manage fluids without making the patient worse? Fluid status is one of the hardest things to assess at the bedside. Is Alex dry, overloaded, septic, slipping into shock? And the wrong call here can undo everything that's been stabilized so far. This is where the lab adds insight clinicians simply can't see reliably on physical exam alone. By using hemoglobin and hematocrit, the lab can estimate plasma volume, showing what's happening inside the vasculature, not just what things look like from the outside. When you combine EPB with lactate, it becomes much easier to separate dehydration from hypoperfusion and early sepsis. Add ionized magnesium, and now fluid decisions account for how the heart will actually respond, not just how much fluid is given. Once again, the lab isn't telling clinicians what to do. It's removing the guesswork and giving them the physiological context to act safely and deliberately. So if fluid status tells how Alex is doing, the next question becomes more urgent. Why is this instability happening at all? At this point, fever, altered mental status, hypotension, and elevated lactate aren't isolated findings. They are a pattern that immediately raises concern for sepsis. And when sepsis is suspected, timeliness and accuracy matter. Blood cultures have to be drawn before antibiotics start, because once the window is missed, the diagnosis and the opportunity to target therapy can be lost. This is where the lab quietly determines whether treatment is focused or guesswork. At the same time, the lab keeps adding context with serial lactate, plasma volume, ionized magnesium, because sepsis doesn't just cause infection. It destabilizes perfusion, electrolytes, and the heart. Once again, the lab isn't telling clinicians what to do. It's making sure every decision, fluids, antibiotics, escalation is based on truth, not assumptions. If sepsis has been addressed and things still don't make sense, especially where persistent altered mental status, fever, or seizure are involved, attention shifts to the one area certainty matters most, the brain. Concern now turns to a possible CNS infection or bleed, and pressure rises fast for everyone involved, especially the lab. CSF testing, as you know, is high stakes, time sensitive, and traditionally very manual. Results can vary based on who's on shift, how quickly they can work, how stressful the situation is, and delays here directly prolong length of stay. That's why consistency matters so much at this point. Reducing variability isn't about efficiency, it's about delivering reliable answers in minutes when there's almost no margin for error. At the same time, the lab is still watching for factors that can mimic or worsen neurological symptoms, like severe magnesium abnormalities, that can drive altered mental status, neuromuscular dysfunction, or seizures. So once again, the lab isn't just reporting results, it's protecting the patient and the care team at one of the most critical decision points in Alex's journey. If CNS infection has been considered and things still don't fully add up, the lab has to ask the next question. Are we missing something hidden? When altered mental status remains unexplained, chemistry may tell us that something is wrong, but it doesn't tell us why. And that's where osmolality becomes critical. Measured and calculated osmolality let the lab step back and explain the physiology behind the numbers. A high osmolality gap immediately raises concern for toxic alcohols and can completely redirect care. A normal gap shifts the focus back towards a metabolic or water-based cause. This distinction matters because missing toxicity or chasing something that isn't there both delay care, and standard chemistry panels won't show it. So once again, this isn't about adding more tests. It's about giving clinicians clarity so they can stop guessing and move forward with confidence. Now that we've narrowed the diagnosis, whether it's infection, toxicity, or a metabolic issue, there's still one last question the lab has to answer. Can every result we've delivered actually be trusted? And this is the part of the patient journey most people never see, but it's what everything else depends on. Every test we've talked about, glucose, electrolytes, osmolality, cultures, CSF, is only as good as the process behind it. That means accurate volumes, trained operators, and results that stand up to audit, even when things are busy and high stress. That's where quality and process control come in. Liquid volume verification isn't extra paperwork. It's what protects every upstream result and prevents quiet errors that lead to rework and risk, demonstrating that the lab's job doesn't end when a number is reported. It ends when that number can be trusted and when clinicians can act on it with confidence. This is where everything we've talked about comes together. When a non-responsive patient arrives in your lab, arrives in your ED, the lab isn't delivering isolated test results from disconnected instruments. What the lab is actually delivering are sequential clinical answers, each one safely guiding the next decision. Glucose answers what can be corrected immediately. Blood gases, lactate, electrolytes, and ionized magnesium reveal shock or cardiac risk. Renal function impacts every downstream decision, from imaging to medications. And fluid status and osmolality prevent harm from over or under treatment. Cultures in CSF make sure we're treating the right cause, not just acting fast. And behind it all, quality and process control ensure every answer can be trusted. So what the lab really delivers in this story isn't numbers, it's direction. The lab shortens decision time, reduces variability, and makes treatment safer for patients and for clinicians. That's why, in this journey, the lab isn't a back office function. It's the clinical decision engine, quietly turning chaos into clarity when it matters most. So when you step back and look at this whole journey, the question we opened with really comes back into focus. What are we actually talking about? With Nova Biomedical, the lab isn't a support function. It's the clinical decision engine. It's how teams get the right test at the right time with the right interpretation, so life-threatening problems are corrected faster and more safely. This isn't about individual devices. It's about a more proactive, connected approach to care, where one patient sample combined with lab expertise drives earlier insight for better decisions. Through Alex's journey, we saw how glucose safety, renal function, fluid status, osmolality, and infection risk are all connected, and how the lab leads every one of those decisions. And that's exactly what hospitals are being measured on today: outcomes, length of stay, cost, and patient-provider satisfaction. So the bottom line is simple. With Nova, the lab isn't working behind the scenes. It's the force that turns uncertainty into action and gives patients their best chance to recover. And with that, I'll turn it over to Jessica McDermott, who will show how we bring Alex's point of care and critical care to journey to life every day. Thank you for your time.
Thank you, Brian. As we continue Alex's journey from admission to treatment and ongoing monitoring, the laboratory plays a constant role behind the scenes. Glucose testing is one of the most widely used and operationally complex tests in the hospital. Let's talk about what it means when that testing is truly interference-free. StatStrip is the only glucose meter FDA cleared without restriction for all patients, all sample types, and all trained operators. That all patients language is critical. It means adult, pediatric, neonatal, critically ill, without exceptions, exclusions, or conditional use statements that labs need to interpret or manage. It also applies to all sample types: capillary, venous, arterial, and neonate, which is essential in ICU and high acuity environments where sample access varies. And importantly, this clearance applies to all trained operators under a waived designation, eliminating the need for alternative workflows or escalation to the lab. Many competitors have tried to reach this designation, but no other glucose meter has matched this level of unrestricted FDA clearance. This achievement reflects the strength of StatStrip's underlying science and sets the foundation for why interference-free testing matters so much for patients like Alex, and especially in real hospital practice. Historically, many glucose meters used in hospitals were cleared through a legacy over-the-counter pathway, a process originally designed for home use devices, not acute care medicine. Those studies were small, often fewer than 200 patients, and conducted before the FDA's hospital-specific guidance introduced in 2016. Most importantly, they excluded critically ill, high-risk, and medically complex patients, exactly where glucose interferences matter most. As stated in the CLSI POCT 12A3 guidelines, Studies should be carried out using samples from patients in the care areas where the device is intended for use, with a range of morbidities and conditions expected in the target population. And that is exactly what Nova Biomedical did. StatStrip was intentionally developed, tested, and FDA cleared through the professional use hospital-grade pathway, a framework created specifically to reflect the realities of hospital medicine. Under this pathway, StatStrip glucose was evaluated in large, diverse, critically ill populations, including ICU patients. The validation was intentionally rigorous. More than 18,000 patients across multiple ICU and critical care conditions, over 17,000 capillary specimens, and over 1,800 arterial venous specimens, assessment across over 8,000 potential interferences, accuracy demonstrated against central lab hexokinase reference methods, and comprehensive safety verification using multiple independent risk models. This level of testing was not theoretical. It was performed using StatStrip glucose in real patients under FDA's highest expectations for hospital use. That is why StatStrip's FDA clearance is unrestricted. All patients, all sample types, all trained operators. No conditional language, no exclusion statements, no policy workarounds required by the lab. The takeaway for the laboratory is clear. Not all glucose meters are held to the same high standard. StatStrip glucose was tested to the highest one. Its performance was proven where complexity is greatest, and that foundation is what enables truly interference-free glucose testing across the hospital with regulatory confidence. StatStrip wasn't built to minimize interferences. It was engineered to eliminate them whenever possible and to protect patients when elimination isn't possible. At the heart of this is Nova's multi-well strip technology, which uses 4 distinct wells to independently evaluate the sample and its conditions. This allows the system not only to measure glucose, but to actively detect factors that could compromise accuracy, including hematocrit variation, which is a known risk in critically ill patients. What's important from a regulatory and safety standpoint is that StatStrip does not force a result. If the system determines that accuracy cannot be guaranteed, it suppresses the result altogether. That behavior is intentional because reporting no result is clinically and regulatory safer than reporting an incorrect one. For the lab, this means fewer questionable results to investigate, fewer downstream confirmations, and strong defensibility during inspections. The lab can confidently stand behind the result or the decision not to report one, knowing the system is operating within validated safety parameters. Ultimately, this design philosophy is what enables StatStrip to support unrestricted use across patient populations while maintaining regulatory confidence. It's not just accurate testing, it's controlled, defensible, safety-first testing. StatStrip doesn't just deliver numbers, it delivers results the lab can confidently defend. Let's watch a quick demo of a patient glucose test. As this demo runs, I want to ground this real-world impact. StatStrip glucose testing happens constantly. About 20 StatStrip test strips are used every second of every day across hospitals around the world. That volume matters because it means this system is not theoretical. It's being relied on in the most demanding care environments over and over again. What you're seeing here is a straightforward workflow, but underneath that simplicity is hospital-grade science. So while this looks like a quick bedside glucose test, what the lab is really delivering here is regulatory, defensible, interference-free testing at scale under real-world hospital conditions. When glucose testing is truly interference-free, the benefits to the laboratory go well beyond accuracy. First, there's no need to define critically ill. Labs are no longer responsible for drawing clinical lines or creating internal policies around which patients qualify for which testing method. Second, there are no alternative testing pathways to design, validate, train, or audit. 1 meter, one workflow across the hospital. Because StatStrip is CLIA-waived for use across all patient populations, labs avoid high complexity reclassification, additional validation requirements, and documentation burden. From a regulatory standpoint, this simplifies inspections and helps reduce citations tied to inappropriate meter use or patient restrictions. Operationally, it means less lab intervention, fewer confirmatory tests, and fewer escalations back to the lab, allowing staff to focus on higher value work. Ultimately, interference-free testing removes complexity, reduces risk, and supports consistent, defensible glucose results throughout the hospital. Once glucose is addressed, Alex's journey quickly becomes more complex. Renal function, electrolyte instability, and fluid status all begin interacting, often simultaneously, and each decision builds on the last. This is where time pressure increases, variability rises, and the labs feel the operational strain most acutely. The question becomes, how does the lab continue to deliver fast, reliable insight without adding downtime, complexity, or staffing burden? That's exactly what the Prime platform was designed to address. Let's look at how a single, standardized critical care testing platform helps the lab meet the challenge with speed, reliability, and operational simplicity that today's care environments demand. From a laboratory perspective, one of Prime's biggest advantages is standardization. Across Prime models, you're working within a shared user interface, QC philosophy, consumables, and connectivity, which simplifies validation, cross-training, and oversight across multiple care areas. Our quality framework is built on true liquid quality control, not just electronic checks. Liquid QC verifies the entire system, sample path, chemistry, and measurement, giving the lab confidence that performance reflects real patient testing conditions. That's complemented by electronic supplemental quality monitoring that continuously checks system function in the background, helping detect issues early without adding manual steps. Combined with design features like the safety sample port for hands-free sampling, clot block technology to avoid downtime, and batch sampling on select models, Prime helps labs maintain control, safety, and uptime without adding instruments or staff, all under one consistent lab standard the team can reliably control. Beyond speed and standardization, Prime also expands the kind of insight available at the point of care. Direct ionized magnesium provides clinically relevant electrolyte information that total magnesium often misses, especially in critically ill patients. Whole blood creatinine and eGFR support faster renal assessment without delays tied to sendouts or batching. And importantly, Prime measures hematocrit and hemoglobin directly, rather than calculating or estimating them. In unstable patients, assumptions break down. Measured hematocrit and hemoglobin provide more reliable context for anemia, fluid shifts, and oxygen carrying capacity. And they directly support the accuracy of other results the lab is reporting. An estimated plasma volume adds physiologic context to fluid management decisions without requiring additional testing or interpretation burden. Together, these capabilities help the lab move beyond reporting numbers to enabling safer, more informed clinical decisions. As this demo runs, look at this from the lab's perspective. What you're seeing is a single, standardized critical care platform delivering rapid, lab quality results from whole blood without adding complexity. Prime Plus is designed to protect uptime and control without adding manual burden. And the insight goes beyond basic results, measured hematocrit, renal markers, ionized magnesium, giving the lab reliable context not just numbers at the point of care. This slide reflects the reality many labs face today. Fragmented critical care testing across multiple analyzers, each with its own interface, QC, consumables, and training. That complexity drives inefficiency, increases risk and demands, and constant lab oversight. Downtime, manual QC, and limited visibility further delay results and decision-making. The Prime platform replaces fragmentation with standardization. A single, unified platform across care areas simplifies training, validation, and operations. Built-in protections like the safety sample port and clot block reduce interruptions, while True Liquid QC with continuous monitoring ensures proactive quality without added burden. With centralized oversight through Novanet and more actionable results at the point of care, labs gain control, reduce delays, and enable faster clinical decisions. Bottom line, Prime removes operational friction, helping labs do more with less complexity, lower risk, and greater confidence. Now, let's turn to Jessica Narigian to continue Alex's journey.
Thank you, Jess. As we continue to look at Alex's journey, it is so important to have reliable and consistent instruments in the lab to help lead to a proper and timely diagnosis. First, I'll focus on osmolality, a test that seems simple but carries critical clinical significance. Next slide. Running osmolality in-house gives labs fast, confident answers when they're needed most. That's exactly what Advanced Instrument Solutions provide. Accurate results, streamlined workflows, and confidence even with staffing constraints. From the Osmo One for lower volume labs to the fully automated Osmo Pro Max, there's an osmometer for every clinical setting. So why do labs use it? Speed, no sendouts or batching. Workflow is simple, automated processes. And reliability, consistent results labs trust every single day. Clinically, osmolality helps clarify urgent questions like fluid and electrolyte imbalances or possible toxic ingestions, supporting safer, faster treatment decisions when minutes matter most. And the method is straightforward. Osmolality is measured by freezing point depression, a method that reflects the total concentration of dissolved particles in a solution. Next. It's important to understand the why behind clinicians ordering osmolality, especially when routine chemistry doesn't match the clinical picture. In Brian's patient journey, Alex's sodium abnormalities and concern for toxic ingestion highlight the need for additional testing, including measured osmolality. Osmolality is often used to quickly clarify complex high-risk cases, particularly when symptoms don't align with sodium, glucose, or BUN alone. Calculated osmolality is an approximation based on select measurements, but measured osmolality directly reflects everything dissolved in the sample through freezing point depression. While both can provide important information, measured osmolality provides the lab with the total picture, not just a fraction. That difference matters. A gap between the two immediately signals something unmeasured, often changing diagnosis, urgency, and treatment. So the takeaway? Osmolality is simple but critical. It plays a key role in identifying hidden imbalances and disorders, making accuracy essential when decisions must be made quickly. In hospital settings, osmolality isn't just a number. It's a critical value that guides urgent decisions that impact patient care, when accuracy is not negotiable. Our wide variety of instruments helps the lab run testing efficiently, integrate seamlessly with LIS, and remain compliant even under high volume and staffing pressures. This results in faster clarity for clinicians and confidence for the lab without the added operational burden. As you watch the short demo on our Osmo Pro Max, notice how simple and streamlined osmolality testing has become. First, you'll see how quickly the sample is loaded. No batching, no complex prep. This is designed for real hospital labs where staffing are stretched and every step has to be made simple and repeatable. As the instrument run begins, Osmo Pro Max measures osmolality using freezing point depression, the gold standard method. That means a true measured osmolality, not just a calculated estimate. The Osmo Pro Max also provides labs the option for stat testing, adding samples as you receive them, improving turnaround times. Everything here is automated, minimal hands-on time and consistent execution shift to shift, which helps reduce variability and protect result reliability. Results are delivered quickly and clearly, so clinicians aren't waiting on sendouts or batch testing. The speed is critical when osmolality is guiding urgent decisions. With the ability to integrate into a system's LIS, robust QC measures baked into the instrument, the Osmo Pro Max provides the labs with a total solution. And what this workflow shows is confidence, fast turnaround, gold standard accuracy, and a system built for today's staffing realities, helping labs deliver answers clinicians can trust when timing truly matters most. Now, let's shift to microbiology, where time and consistency are just as critical, especially when managing suspected infections. Next. The Enoximat 3 is an automated anaerobic jar system designed to create precise, repeatable environments for bacterial cultivation without the manual aspect. Instead of relying on sachets or guesswork, the Enoximat uses an automated gas exchange process with nitrogen, CO2, and oxygen and hydrogen to rapidly establish anaerobic, microaerophilic, or custom conditions. Why labs use it is straightforward: faster and more reliable bacterial growth, consistent conditions across runs, and significantly less hands-on time for technologists. The Enoximat produces reliability, quality assurance, and removes the guessing out of your microbiology workflow. And clinically, that consistency translates into faster identification, quicker treatment decisions, and greater confidence that what grows is truly representative, not just the result of variable conditions. So in the patient journey, primarily with Alex Morgan, of continued altered mental status, infection is part of the question. This is where the Enoximat can help the lab deliver results that are not only faster, but more dependable. Anaerobic testing directly affects patient care timelines. The Enoximat creates consistent, repeatable anaerobic environments to improve the speed and quality of bacterial growth, supporting faster identification and treatment decisions. By reducing manual steps and gas use, labs gain better consistency, stronger QC, and lower costs. A simple 2-button workflow, minimal training, and the ability to run up to 4 jars at once support higher throughput. Clinically, the result is for faster organism recovery, quicker treatment decision, and a shorter hospital stays. As the video begins, you'll see the Enoximat system alongside the culture jars. There are 2 different jar options: our standard acrylic jar on the right and our ergonomic jar on the left. Plates are simply loaded into the jar of your choice and sealed. No manual gas mixing is needed. Our Paladox catalyst can be added to the jars for anaerobic recipes. Here you will see both a standard jar as well as an ergonomic jar being connected to the system. So simple. Next, the instrument has multiple QC checkpoints to ensure that the jars are not compromised, so the ideal environment can be created. Once jars are connected, choose the recipe you would like to run and simply press start. The system automatically begins the gas exchange process using precise software-controlled cycles. This ensures that the atmosphere is created consistently every time, regardless of operator or shift. Here's the key difference from traditional methods. Enoximat actively removes oxygen and replaces it with defined mixtures. This gives you repeatable, validated conditions instead of relying on passive reactions that may vary. In just minutes, the environment is fully established, much faster than manual methods or chambers. Faster setup means faster organism recovery and ultimately faster clinical answers. You can also run multiple jars at once, which that flexibility supports higher throughput without the added complexity. What this workflow shows is confidence, repeatable environments, reduced hands-on time, lower gas consumption, and stronger QC traceability, all of which help the lab deliver reliable culture results sooner, supporting faster patient treatment. Okay, so let's transport to the hematology lab. CSF cell counting is one of the most urgent and high-pressure tests in the hematology lab, which result that can change a patient outcome. Next. GlowSight is purpose-built for CSF, delivering fast, accurate, total nucleated cell and RBC counts, even at very low levels. The workflow is very simple. A small sample is added to a disposable cartridge, loaded into a closed system, and analyzed automatically using fluorescence technology with results in a matter of minutes. Labs gravitate towards the GlowSight because with the instrument, the process removes manual variability and delivers consistent results regardless of workflow or staffing. Clinically, that consistency means faster confidence, supporting a quicker diagnosis, treatment decisions, and better outcomes. With Alex, time was essential, ensuring that an altered mental state, fever, and seizure are not pointing towards an infection or stroke. A CSF count is a no-brainer. GlowSight reinforces why standardization is critical for CSF testing. At very low cell counts, even a single cell can change a clinical interpretation, exactly where manual methods can struggle most. GlowSight delivers reliable sensitivity at clinically relevant low levels, replacing manual variability with reproducible results. For the lab, this means greater confidence, less rework, and faster turnaround times in critical situations. Clinically, consistent results support faster detection of infection or hemorrhage and better disease monitoring over time. Standardizing CSF counts isn't just about efficiency, it's about trusted results when neurological decisions really matter most. When you're going to run a test on the GlowSight, a technician will pipette a CSF sample into 2 tubes, mixing one with the RBC assay and the other sample with the TNC assay. The reagent's job is to stain the cells so the GlowSight technology can read and measure them efficiently. The process is the same for each assay as seen here. The RBC mixture will incubate at room temperature for 3 minutes while a technician can run the test on the TNC. A technician will pipette the CSF mixture into the cartridge and then place that into a vacuum station to remove the liquid, leaving the stained cells in the bottom of the cartridge. It then goes into the GlowSight to be read. Once the cartridge is inserted, the process is fully automated. At this stage, the GlowSight uses fluorescent-based imaging to detect clinically relevant cells. This is what enables accurate total nucleated cell and red blood cell counts, even at extremely low levels. The same process is then repeated for the RBC mixture. Results are delivered within minutes and with reliability counts down to less than 1 cell. That speed and sensitivity directly support faster decisions around infection, bleeds, or neurological injury. What GlowSight highlights is confidence, fast turnaround times, high sensitivity at low counts, and consistent results when minutes matter. And lastly, I want to touch on liquid handling verification because it impacts every result in the lab. Next, perfect. Accurate liquid handling is the foundation behind every test we've discussed. If volume is off, everything downstream is at risk. Think about all of the tests Brian's patient Alex needed when entering the ER. Pipettes are a critical aspect of these tests. And without proper volumes, the results could have been negatively impacted. And the importance of correct volumes is the true beginning of a successful treatment plan. Artel's PCS and MVS systems verify pipetting accuracy across manual and automated workflows by directly measuring dispensed volume and delivering objective pass-fail results. For the lab, this means catching errors early, reducing rework, supporting compliance, and maintaining a clear audit trail without the added documentation burden. Clinically, accurate pipettes protect patient results, preventing prep and dilution errors so decisions are based on the data a team can trust. RTEL is an aside system. It's a quiet safeguard behind every reliable result. The PCS and MVS reinforce a critical truth. Accurate volume underpins every clinical result. RTEL solutions verify pipetting accuracy across workflows, supporting compliance and confidence. In-house calibration and operator training reduce variation and prevent silent errors. The importance is clear. PCS and MVS ensure the accuracy that you never see, but every clinical result will depend on it. And here is a quick high-level demo video highlighting the ease of use of the PCS. In as little as a few steps, you will have objective results within minutes, showcasing an intuitive software platform that provides labs with the information needed to ensure pipettes and operators are reliable. PCS is a system built for confidence and compliance. So in closing, in Alex's case and in countless others, our technologies turn uncertainty into clarity because behind every result is a patient waiting. And our purpose is to make sure that the wait leads to the right care at the right moment. And now I will hand it over back to Brian to close out our presentation. Thank you.
Thank you so much, Jessica. And Jessica, great job to the both of you. Really appreciated that. So let's close where we began, with Alex, the patient. When the questions are urgent and the story isn't clear, and when the story is urgent and isn't clear, the lab becomes the clinical decision engine. What you saw today is that NOVA isn't a collection of disconnected instruments. It's a unified approach that helps the lab to deliver sequential clinical answers, the right test at the right time with the right interpretation, so teams can move faster, safer, and with far more confidence. And it's bigger than results. It's standardization across the clinical continuum, from treatment decisions to turnaround times, connectivity and security, customer support and consumables, so labs can keep care moving without adding burden. The takeaway is simple. With Nova Biomedical, the lab isn't just supporting care, it's driving it. And we're here to be the partner that helps you deliver better care and confident outcomes every time. Next slide. With that, if there are any questions in the chat, we can pause here. And if something comes to mind later, or if you'd like to connect with a member of our team directly, you can scan the QR code or visit our website. Don't know if there are any questions. There's nothing in the chat. Okay, so thank you, Ben. Maybe if you could come to the final slide, we'll close. And if people do have questions, they can stick around. We'll let people go. So as we come to a close, on behalf of all the speakers and those who put this content together, we want to say thank you for the critical work you do every day, recognizing that it is often behind the scenes. When answers are needed fast and the margin for error is small, there's the lab. What we shared today is really about your impact, the decisions you enable, and the patients that you protect. If you're an existing customer of ours, we'd like to thank you for your partnership. And if you aren't yet and you'd like to know how we can help, again, please reach out, as we're grateful for the opportunity to partner with you and help you in that mission. Thank you, everyone, for joining us today. We really appreciate it. And thank you for all the work that you do. Thank you.